Statistics from the Ministry of Health indicate that 115 Kenyans are diagnosed with various types of cancer daily. Even more shocking, 75 Kenyans die of cancer daily. This means that in over 42,000 Kenyans being diagnosed with cancer yearly, over 27,000 die, a majority succumbing in the same year of diagnosis.
Why so? Because a lot of the people who are diagnosed with cancer are diagnosed in what we call late stage 3 or 4. What that means is that the cancer has already spread from the original site and it is already in other organs.
National Cancer Institute chairperson Dr. Githinji Getahi says a special focus should be directed towards early detection and treatment of cancer, especially at primary healthcare facilities.
A pap smear can be done by a nurse at a dispensary or a health center. All they need is the necessary chemicals, very, very basic and actually not expensive, to be available where they are, and for them to be trained.
With the financial burden on cancer patients and their families being significant, driving a majority of the affected families into poverty, Dr. Githinji Getahi points out possible ways to moderate treatment costs.
The chronic care fund should actually, or whatever mechanisms we have, should be directed to actually help covering for non-communicable diseases like cancer.
Leading cancers in Kenya are breast cancer at 16.1%, cervical cancer at 12.4%, followed by prostate and esophageal cancers at 8.1% and 7.1% respectively.
Over 80% of the lumps that women feel in their breasts are not cancerous.
Radiation oncologist Dr. Catherine Nyongesa points out key signs and symptoms of cervical and breast cancers, which together claim 16 lives of Kenyan women daily. Cervical cancer often occurs after an individual engages in sexual intercourse with multiple partners.
For breast, majority of the women will present with a lump in the breast. For cervical cancer, women come with initially they have pain during coitus, having intercourse.
She further lays out symptoms for men to look out for in esophageal and prostate cancers. However, it is important that this is conducted by a qualified medic. Esophageal cancer is often as a result of smoking, drinking alcohol, and consuming hot beverages.
For esophageal cancer, you start developing difficulties in swallowing. Prostate cancer, difficulties in passing urine. You may even have complete blockage.
A summit to be conducted between the 2nd and 4th of February 2023 is set to bring together the National Cancer Institute and partners from within and overseas to discuss better cancer management in Kenya. Ben Kirera, K24, Nairobi.